Every day we flow through our lives, working, playing, taking care of our families, never really giving a thought to how hard our heart is working. But so many of us are living with issues that could result in a serious problem called an aneurysm. Today we are at the Orlando Health, Heart and Vascular Institute, and we are thrilled to be joined by Dr. Aleem Mizra. Thank you so much for being here.
Thank you for having me.
So you are a vascular surgeon. Tell me a little bit about what that entails.
So as vascular surgeons, we work on blood vessels throughout the entire body. And we work on several different types of problems, including blockages in those blood vessels, blood clots in those blood vessels, as well as aneurysms, which are categorized as ballooning or a degeneration of an artery to 1.5 times its usual size.
And at some point, these can rupture?
Yes.
And then you have a bleed out in the body.
Correct. So it's our job as vascular surgeons to diagnose these aneurysms, which frequently sit silent, but to find these aneurysms and then to monitor them until they reach the appropriate size to be repaired.
Okay, so the great part is if you find it and you catch it before it ruptures, there's a whole bunch of stuff you can do these days.
Correct. What a stent does is it allows us to perform a minimally invasive surgery without making an incision on a patient. So we're able to go through the skin and put large IVs into the arteries on the top of the leg or in the groin, and then deliver a stent up into the aorta and seal the aneurysm from the inside out. You know, we need to measure the size of the aorta to be able to determine what size stent someone needs. We need to measure the length of stent that we need to use. And so nowadays we actually have a very nice tool where we're able to put a patient CT scan on a special program, take very accurate measurements of the diameter of the width of the aorta as well as the length needed, and we're able to determine what type of stent they need. Now, if the aneurysm extends up to the kidney arteries and we're not able to achieve a seal, that's where designing a customized stent comes into play.
And Orlando Health has basically brought this technology to our community.
Yes, so this technology has existed in the United States, but we have recently really built the program, expanded the program, and expanded the use of this technology beyond what it was being used right here in Central Florida.
And it is minimally invasive, which means there's less recovery time, there's less time in surgery, it's easier on the patient's body, all of those things.
Correct.
It's another reason to choose well with Orlando Health. If you would like more information, you can visit orlandohealth.com/heart.